Did you know that watching dogs poop can actually help you get an excellent epidural when you're in labor? Keep watching and I'll tell you how. Hey friends, Nurse Kelly here. Today I'm going to talk about something that seems simple but makes a huge difference when it comes to comfort and safety and success when you're getting an epidural. That is sitting and how to position your body while your epidural is being administered. I know it can feel intimidating when your care team says that you have to curve your back like a shrimp or like an angry cat. And when you're in the middle of a contraction, it's hard to listen and think, okay, what does that even mean? So let's break it down and make it really clear and easy. Okay, the first thing we're going to talk about is positioning and why it matters. The epidural works by placing a tiny, flexible catheter in the epidural space. That's an area that's accessed by inserting a needle in between the bones of your lower back. To get there, your anesthesiologist needs a clear pathway, and that's between your lumbar vertebrae. I'm going to try to show you. The more you curve your back, so pretend that these are two lumbar vertebrae. The anesthesiologist is over here. The more you curve your back, the more it opens up the space so that they can get into the lumbar vertebrae. So when your nurse or your anesthesiologist says curl up like a shrimp or round your back, what they're really asking for is for you to open up those spaces in the bones in your lower spine. Think of it this way. Your job is to make like a rainbow out of your lower back. So I'm going to use an analogy. This is my favorite analogy, but not everybody thinks of this. And it makes everybody laugh a little, but what I want you to think of when you curve your back for an epidural is to make the position of a dog taking a poop. And if you've ever seen a dog taking a poop, this will completely click for you. If you haven't, you may need a different analogy, but I'm going to show an illustration so that maybe, hopefully, you can understand it. Okay, I'm going to try to illustrate this. So when a dog takes a poop, they curve the lower part of their back and they hunch over. They don't curve the top part of their back. And that's important because this isn't the part that the anesthesiologist needs. It's the lower portion that the anesthesiologist needs. And you need to kind of push that part out back towards the anesthesiologist so that the vertebrae back here open up so they can find the right space in your spine to put the epidural needle. So think about a dog taking a poop. Equally important is how you sit in the bed. Okay, so I have a little mattress here. This is the edge of the mattress. One of the best ways to sit is crisscross applesauce. So this opens up your sits bones and gives you extra support. Also opens up your pelvis, helps the baby come down. But you can also easily curve your lower back when you're in crisscross applesauce. Now, some anesthesiologists will ask you to sit with your legs out in front of you and grab the bed in front of you. So you can put your feet like this and pull forward, pull back on the bed and push out your back. And I'll show you from the side what that looks like. So if you put your feet in front of you and pull forward, you can see that you're pushing out the lower part of your back. And that's also a really good way to sit. Another thing you can do that really helps with positioning is you can hug a pillow. So usually I will have my patients fold the pillow in half, then kind of reach around, push out their lower back, put their head down and rest it on the pillow, and relax their shoulders. This really helps open up the back. I'm going to show you from the side. So you got the pillow folded in half. Reach around the front of the pillow, relax your shoulders, and put your head down. You can see that this is opening up this part of the back so that the anesthesiologist can get into where they need to go. Okay, I'm going to try this. Now, most anesthesia providers are going to ask you to scoot to the side of the bed that's closest to them so that they can access your back. So pretend that's where the anesthesiologist is. What you're going to want to do is scoot your butt to this. I'm going to do this forward so that you guys can see. To as close to the edge as possible, where the anesthesia provider can get to your back. So, for instance, if you're sitting with your legs straight, you're going to grab, you see my fingers, you're going to grab the edge of the bed and push out, and you're going to have your back closest to the anesthesia provider. Your nurse will be over here helping you through contractions, and your anesthesia provider will be over here working on your back. While you're in position to get your epidural, no matter what position your anesthesia provider recommends, there are 3 key things that are very important. Number 1, you want to stay as still as possible. Number 2, you want to breathe slowly and deeply. And number 3, you want to keep your focus on curving your lower back. If you have a contraction while your epidural is being placed, you will want to let your anesthesia provider know. If the needle isn't in yet, they may let you move slightly. But once the needle is in, it is crucial that you hold still until they're done. Even small movements, like lifting your head or turning your head, can activate the paraspinal muscles, and that can shift the spot where the anesthesiologist is aiming for. So if your care team asks you a question while they're working, you're going to want to keep your head still, and you'll answer the question without moving your neck. It makes their job easier and the process safe and smooth. It only takes a few minutes, but those few minutes of stillness can make all the difference. Once your anesthesia provider says you're in a good position to place your epidural, here's what happens next. First, they will clean off your back with a cold antiseptic soap. Once that dries, they're going to place a drape on your back. It's a plastic drape with adhesive. In the middle of that drape, there's going to be a hole, and that's where they're going to access your back to place the epidural. After that, they will inject local anesthetic in a few spots around the area so that you won't feel the big pinch on your skin when they start to place the epidural needle. You will feel a little bitty bee sting feeling when they inject that local anesthesia, the first couple injections. And that is because that local anesthesia, it stings when it goes in. So it will just feel like a bee sting. It will be okay. You can get through it because it's going to save you from feeling the actual insertion of the epidural needle. From there, most of what you'll feel is a little bit of pressure, sometimes a little zing or a tingle if a nearby nerve is brushed. It's not harmful, it just helps the anesthesiologist know exactly where they are. So if you feel that, you want to tell them, and you want to tell them which side you feel it on. While the epidural catheter is being threaded through, once they find the spot, you'll feel a little 2 to 3 second cramp. You might feel like a zing down both legs. That's all normal. And once the epidural catheter is in place, you're not going to really feel anything. They will do a little test dose either before or after they tape everything up, and then they will start the medication. Most anesthesiologists are going to tape the epidural catheter to your back really well with a big old clear tegaderm, which is an adhesive plastic that they put over your back, and it stays there until the epidural comes out after you deliver your baby. You want to be careful though, because if you slide up and down in your bed, there's still the possibility that some of that tape could come loose. So you're going to want to lift and move whenever you move. After you get your epidural, they're going to lay you flat on your back with a slight tilt, probably to your left side, to make sure that you get blood flow to you and your baby. It's important to stay in that position where you're laying mostly flat because it helps the medication from the epidural spread to both sides. After that 20-minute period, your anesthesia provider will probably pop back into your room to make sure that you've achieved adequate pain control. After that, your nurse can help you move into various positions to help the baby come down into your pelvis. You can go side to side. Sometimes, if your legs aren't super numb, you can get into a hands-knees position, and the bed will help you a lot with movement. You can do a sitting up throne position, and there's lots of different other ways that your nurse should be able to get you into position so that your baby can come down. So now you know how to get an epidural like a pro. Remember, your only job during those few minutes that you're getting the epidural placed is to stay still, breathe, and curve your back. Your team will help take care of the rest. Epidurals can be an incredible tool, and knowing how to sit makes the experience faster, safer, and so much more comfortable. If If you want my full epidural guide for preparing for labor and birth, comment notes below and I'll send it to you. And if you liked this video and found it helpful, be sure to share it with a friend.